A charity is warning that almost 700,000 people could develop cancer in the next 20 years because they're overweight. Cancer Research UK says its prediction supports calls for a tax on sugary drinks to try to tackle obesity. Well, I'm joined now by Dr. Malik, who's a consultant cardiologist. Thanks very much indeed for joining us. A lot of people might say that they thought that obesity was linked to heart disease, but a lot of people might be surprised to hear it being linked to cancer as well. Does it come as something of a surprise to you?
No, it doesn't. I think the association is not as strong as with cardiovascular disease. The two biggest killers in this country are cardiovascular disease and cancer. So the news that it causes blood pressure, diabetes, heart attacks and strokes is old news. And I'm hoping that the impetus given by Cancer UK and other charities highlighting the cancer risk will make people think even harder, because the fact is that most cardiovascular disease people think can be treated. Cancer is a worry. And if that forces people to think about their weight and even lose a couple of pounds, that is going to have a major impact both on their cardiovascular health and on their cancer risk.
So given that obesity then is associated with cancer, cardiovascular disease, diabetes, how would you characterise the scale of the threat that obesity poses in this country?
It's absolutely enormous. I think it's the whole of the Western world is facing a crisis here. And we had a really large focus on lipids as the enemy. Fat was the enemy. I think the new enemy for this century is going to be sugar, and the sugar lobby has been very strong up till now. The tobacco lobby took quite a long time to be beaten back, and I think we're going to have to do the similar thing with sugar. Even myself, I ended up buying some cakes which were fat-free. Well, they were absolutely loaded with sugar. That's why they were fat-free. They were very tasty, but they're actually very bad for you, and a balanced diet is always better. So the reason that obesity can lead on to cancer was highlighted by your reporter. It changes the way the hormones work in the body. It causes inflammation. And of course, even simple things like acid reflux are much greater when you've actually got, when actually you're overweight. And that acid irritating your esophagus can lead on to things like esophageal cancer.
So so really, the doctor's advice is steer clear of sugar as much as you can. Do we need help in doing that? Do you back this call for a sugar tax of some kind?
I think it's been tried before, hasn't it, that you try and change people's behaviour by taxing them. I'm not sure a tax on cigarettes actually really changed anything. It was actually banning smoking in public places that's led to a significant drop in smoking. So a tax alone probably isn't going to work. I think we have to work on education, and I would push the cancer message because I think that's frightening enough to make people take notice.
Well, yes, you say frightening enough to make people take notice, but there are lots of frightening warnings out there, aren't they, that we hear all the time. We're being told about the dangers of drinking too much, of eating too much. Don't people become slightly immune after a while? They stop listening. Isn't there a risk that too many warnings aren't effective?
I take your point on that, but actually I would say that most people are more worried about cancer and possibly stroke than they are about having a heart attack or even their liver packing up in the long term. I think the cancer message is so strong in all of us. I'm a doctor. I'm more worried about cancer than I am about cardiovascular disease in my own body, that I think it is a message to push. And I think the solution is very simple. It's not saying change your diet radically. It's saying, well, you enjoy that meal. Why don't you have 2/3 of it, maybe even 2 or 3 times a week, rather than having the full portion? And that will be enough to begin to get you to lose weight. It's actually very straightforward to begin to lose weight, and doing a radical diet is not the way forward. You won't be able to sustain it. It's actually doing something every week, even a small amount, makes a much more substantial difference.
Well, it is a simple message, and it sounds so simple when you say it, just cut down on the amount you eat. But for a lot of people, it's much more complicated than that, and they do find it incredibly difficult. Do you think there should be more support for people to try to help them lose weight? Because it can be incredibly difficult.
I completely agree, and I think people have to be aware that your body is set at a particular body mass. So there are some people who can eat anything they like and they'll stay slim, and there are some that eat not a great deal and they're overweight. So we have to try and overcome what your natural body homeostasis is going to do. And so for you, you may not be stick thin ever, whatever you try and do. But even in that situation, if you can lose a few pounds, that will be good. And how can we help with that? Well, walking one more stop rather than catching the bus or the tube is something that will make you lose weight. And as I say, these access to dietitians, that may well be a good idea. And I think as the epidemic increases, then perhaps we should have easier access to dietitians who can offer advice, pharmacists that can offer advice. There are easy portals which don't necessarily involve a doctor.
And ultimately, do you think that information clearly, but punishments work better or support works better? What is going to ultimately make the difference? And should we be looking at other factors as well? Should there be more pressure on the food industry, for example, to use less sugar in their products?
I think that's certainly part of it. So we've had pressure to use less fat. Now I think we should have pressure to use less sugar. I think punitive action rarely works. I think actually making it difficult so that the environment changes, for example, the smoking ban, making it difficult for access to high sugar foods may have an effect. But I think it is about education. I think we all want the best for our kids. And I think if we learnt that our kids were more likely to get cancer in the future, then I think we'd be more careful about what they ate. So I think education is the key.
OK, well, very interesting to talk to you. Dr. Iqbal Malik, thanks very much indeed.